Good evening, everyone. Thank you so much for joining us today. We have a lovely town hall planned for everyone with our Youth Advisory Council. May I introduce Lisbeth Becerra as our moderator for this evening.
Thank you so much, Kimberly. Good afternoon, everyone. I'm so glad to see you all here today. I wanted to introduce myself. I'm Lisbeth Becerra, Health Educator for the Youth Advisory Council. Welcome to Public Health Week Day 2, Public Health Workforce, Essential to Our Future. And for our event today, we wanted to give it this title related to the Youth Advisory Council in developing our future public health leaders today. And it's my honor to introduce Dr. Ferrer to open our event with some remarks and a warm welcome. And Dr. Ferrer, you can take it away for us.
Thank you so much, and good afternoon, and thank you, Lisbeth, and to all of our amazing youth panelists. I'm so glad that I'm here with you tonight, celebrating National Public Health Week. As Lisbeth noted, today is the second day of Public Health Week. And, you know, all across the country, there are public health departments that are hosting events to highlight the theme for today, which is public health workforce, essential to our future. And that's why we thought it would be great if we could hear from our Youth Advisory Council, where we currently have a group of 31 young people between the ages of 16 and 21, all doing amazing work across LA County to promote the health and well-being of all of our residents. The Youth Advisory Council is made up of, you know, exceptional young people. And I want to share our deep appreciation for the many people on the public health team and the youth advisors who are also helping to make this possible. You know, I want to thank Dr. Gilchick, who's the chief of the Child and Adolescent Health Unit, our Positive Youth Development Initiative co-leads. We've all met Lisbeth, but we also have Kevin and Pamela, who work really closely with the advisory members of the council. We have 8 Youth Advisory Council members that come from our supervisors, the board supervisors. We have 10 senior youth advisors, and we have 20 first-year youth advisors who are also really important to this entire program. I also want to acknowledge that the Office of Supervisor Kuehl has really been a steadfast leader and provided a lot of support for our youth-led initiatives. She wasn't able to join us today, but I'm glad to be able to welcome her Health Services Deputy, Stephanie Cohen, who is watching with us on tonight's webinar. You know, we really rely so much on the amazing and exceptional leadership of Supervisor Kuehl. And, you know, I feel very grateful to be able to work in a county where we have someone who cares so passionately and deeply about making sure that our young people have the resources that they're going to need to thrive. Before we hear from our youth advisors, I did want to take a moment to share why it's so important that we engage young people within the Department of Public Health and across the county in all of our efforts that are aiming to build justice and equity. Historically, I know we all know that the adolescent voice, or the voice of young people, has really been absent from the field of public health. And therefore, it's been difficult for us to be able to provide an accurate youth perspective on health issues that arise and impact teenagers here across the county. At the Department of Public Health, we believe that the best work happens when those who are closest to the work are able to identify what is effective and what isn't, and then they can lead on developing solutions to the challenges. Through our engagements with young people, we've been able to directly listen to all of your ideas and hear your unique points of view. This strengthens the work that we're doing to support you through our programs and services. I know we also can agree that we value our young people because as leaders, we know that they have an active and central role, that when we allow them to have an active and central role, they're going to come up with more appropriate solutions. We hope that by working together, we get to create a new model for collaboration, where the voices of young people are always heard and their input actually drives the programming. rather than asking young people to continue being on the receiving end of adult-led decisions. Given the rich cultural diversity of LA County, we value the different perspectives that each of the young people on our advisory council brings. And we hope that some of the folks who are listening today to this town hall will consider joining the department's 2022-23 Youth Advisory Council. I'm thrilled that we have an opportunity today to showcase some of our current youth advisors as they share their experiences and their work on the council. You're going to agree with me after you hear from them that they're so impressive, and we're grateful and deeply appreciative. I'm deeply appreciative of all that they've given us this past year. We encourage everyone who's listening with us and participating today to be curious, and we hope that folks will ask questions, engage in the chat, and be inspired to apply and join a future cohort of our Youth Advisory Council. We know that the issues that young people face are many. They're significant, they're distinct, and only young people can capture and communicate the complexity of the challenges and of their lives. So I thank everyone for being here today, and we always invite you to reach out to us, visit our website at ph.lacounty.gov, follow us on social media, and share with us your public health concerns and questions. We are serious about seeking meaningful partnerships with you and your peers. Now I'll turn it back over to Lisbeth, one of our health educators, who will speak in detail about what the Youth Advisory Council is and does. Thanks again for joining us tonight.
Thank you so much, Dr. Ferrer, for that warm welcome and overview of the Youth Advisory Council and the importance of youth having this platform within the Department of Public Health. I wanted to start off with a brief overview of the Youth Advisory Council. And on this next slide, I wanted to start off with the mission of the Youth Advisory Council. You can go to next slide after this one. Thank you. So the mission for the Youth Advisory Council is to promote the well-being and advocate in the best interests of all youth in Los Angeles County. As a Youth Advisory Council, we collaborate with the Department of Public Health leadership to identify county-wide scale health issues plaguing the community to improve the welfare of LA County youth. So this Youth Advisory Council is a county-wide council where we have representation from different regions across LA County. Next slide. And so a little bit of what Dr. Ferrer was mentioning earlier is that the Youth Advisory Council is based on positive youth development framework, which promotes the 5 C's. And the 5 C's that it promotes within the Youth Advisory Council is confidence, competence, character, confidence, character, competence, and caring, which ultimately leads to the youth advisors feeling the confidence to contribute to their own needs, to contribute to their own lives, and contribute to their families and society. So in the PYD principles, it emphasizes the ability of youth and their strengths to succeed when they are faced with certain issues in their community. So we really value their lived experiences. We really value their perspectives. And instead of traditional youth services that focus on fixing problems and being reactive to the needs of youth and seeing youth as troubled youth, traditional services also view youth as recipients and focus on the overall objectives of the program and view it as professional work. But in the positive youth development framework, we really focus on building strengths and of the youth advisors and building connections among the Youth Advisory Council and having positive youth-adult relationships. And we involve not just troubled youth, quote unquote, we involve all youth that come from different perspectives, that have different lived experiences, and view youth as our partners, view youth as participants, and as essential to the Youth Advisory Council programming. Again, we focus a lot on building relationships, and we view this work as not just professional work, but as everyone's work because everyone collaborates within the Youth Advisory Council. So again, the PYD principles, they don't focus on problems. It recognizes that youth have the strengths within themselves to be able to work along with you, other adult staff. And as adult staff, we foster those strengths, and we do that in order to promote the healthy well-being and development of youth, not just in their adolescence, but also as a long-term strategy well into adulthood. Next slide. So as mentioned earlier, the Youth Advisory Council began in 2019. This is just a very quick timeline of how young this Youth Advisory Council is. We started in 2019 with a group of 14 youth advisors, and we've grown every cohort. Surprisingly, through the pandemic, that didn't stop youth from being interested in joining the Youth Advisory Council. And in fact, it actually enhanced their participation in switching to a virtual space. So in 2020 to 2021, our cohort grew to 26 youth advisors. And then now currently in this current cohort of 21 and 22, we have a cohort of 31 youth advisors. And so again, surprisingly, throughout the pandemic, there was still such a huge need for this council. And it's definitely resonated throughout the pandemic that this council was a huge, huge support system for the youth advisors and their communities. And switching over into a virtual platform has actually benefited the adolescent community because we meet them where they are. Next slide, please. So a little bit of the structure of the Youth Advisory Council is that we have sort of a three-prong approach. The first one is that we hire the youth advisors within their service planning areas across LA County. And there they get to work at a health center alongside a public health staff person and do hands-on project work. So they work on what's called their passion projects. And so in their service planning areas, along with the public health staff, they're able to fulfill and be exposed to different public health issues in that specific service planning area and be able to bring to fruition a project of their choice. And so for the next tier is that we convene all of the youth advisors on a monthly basis. And that's where we gather and we organize the meetings to provide leadership development, personal development, networking opportunities. And that's where the youth advisors also share different information with each other. So there's a lot of peer-to-peer learning, a lot of peer-to-peer education. And so in those specific meetings too, there's a lot of skill building and access to professional development opportunities as well. So we meet on a monthly basis, but we also have this third component, which is the mentorship component, where the advanced youth advisors, we call them the senior youth advisors, are able to provide mentorship, support, and encouragement to the incoming youth advisors or the first-year youth advisors so that they're able to help them navigate through their term as new youth advisors and to pretty much, you know, pass over the torch to the next cohort of youth advisors. So there's a lot of support coming from coming from the county, and also coming from the peers themselves who have really offered such large amounts of encouragement to each other for all of the projects that they're involved in. And in this next slide, I think now we are going to be getting into the exciting part of this event, which is getting to know the youth advisors themselves. So now we're going to be moving forward into this panel, and it's my honor to moderate this panel and sharing the space with the youth advisors. We have 6 youth advisors that are going to be participating today, and this is going to be a great opportunity for a lot of our viewers who are between the ages of 16 to 21 years old to really get to see the insight of the Youth Advisory Council and what some of these youth advisors have experienced and what kind of projects they've been able to work on to benefit their community. So let's go ahead and get started with our panel. We could stop sharing the screen now so that we can focus more on the discussions. So for the first question And I'm actually going to turn this one to Giselle to start us off. If you could share, Giselle, what is your name, your pronouns, your service planning area, and if you could also mention what region that is, what grade you're in, so if you're in college or if you're in high school, and how long you've been in the Youth Advisory Council. After that, if you could also share what drew you to apply to the Youth Advisory Council.
Hi everyone, it's so nice to see you all today. My name is Giselle Gonzalez Perez, and I go by the pronouns of she, her. I'm currently a sophomore student at Stanford University, and I am a senior youth advisor for the Youth Advisory Council. I have been involved with the Youth Advisory Council since 2019, since the first cohort, and I serve Service Planning Area, or SPA 7, which is the East region of Los Angeles. What drew me into applying to the Youth Advisory Council was actually my interest in learning more about public health. I was vaguely introduced to the field in high school, and I wanted to get more exposure to it. So one of my high school teachers actually shared the promotional flyer, and I became very excited knowing that this opportunity existed here in Los Angeles. What drew me in was the position description and benefits. The fact that I would have the opportunity to work alongside public health professionals, advocate for my community, and learn more about the field really drew me in. This was exactly what I was looking for, and I think I would like to share that even though I had a vague experience of public health, it doesn't matter if you come from a position where you do not know what public health is, the Youth Advisory Council welcomes everyone. I'd like to pass it to any other youth advisor who would like to speak.
Sure, I can go next. Hi everyone, my name is Alana Cho. My pronouns are she, her, and I am currently in Spot 8, which is kind of the Inglewood area, and I'm currently a high school junior. So far, I've completed one session that started the summer of 2021. I wanted to really join the Youth Advisory Council because I've always been interested in helping my community through acts of service and have been considering pursuing a medical career. So I really wanted to explore the public health side of kind of keeping our community safe. And then I can pass it on to the other youth advisors.
Sure, I can go. Hi everyone, my name is Morgan Mcintosh. My pronouns are she, her, hers, and I'm in the Spot 8 planning area, so that's around the southwestern region, and I'm in the 12th grade. And I've been in the Youth Advisory Council for about 2 years. I'm currently a senior youth advisor, and I was a youth advisor last year. I would say I was specifically drawn to apply to the Youth Advisory Council because of the organization's plethora of opportunities in which driven youth can connect with other ambitious adolescents who share similar interests, as well as experienced professionals within the health field. And I think through these opportunities, you're able to interact with not only your community, but those abroad as well. And I'll pass it on to any other youth advisors.
I can go next. So my name is Arnav Kacker. I am a senior youth advisor in Service Planning Area 7, which is the Whittier area. Pronouns he, him, and I am a first year in college. And what drew me to applying to the Youth Advisory Council was, like many of the other youth advisors, I knew little to nothing about public health, but I loved serving my community, and I was a student interested in pursuing a career in healthcare and in the medical field. And when I came across this opportunity, I thought it would be a great way to learn about both and serve my community while learning about the medical field. And I found that I was able to do both and much more, and found to find a new passion for public health. So that's why I joined, and I'll pass it on to the next youth advisor.
I can go next. Hi, everyone. My name is Yvonne Galicia. My pronouns are she, they, and I am from Spot 8, which is the Inglewood area, and I'm a first-year student at UC Berkeley. I've been with YAC for about 2 years, and I was drawn to apply because I wanted to explore a subject that I was unfamiliar with. I was especially drawn to the idea of getting direct guidance from health educators and directly from people who are working within the county.
Everyone, my name's Evan Bowman, pronouns she, her, and I am in SPA 8, which is the Inglewood, South LA area, and I'm a senior in high school. I was drawn to apply to the Youth Advisory Council because I was really looking for a way to get involved in my community. This was right at the beginning of COVID, and I really wanted to get active and do what I can to help. And I've always been interested in public health and health in general, and I really want to learn more about how the system works. I think I'm
all. Yes, thank you so much, Evan. And thank you all so much for answering that. And from what I heard, you do not need to know anything about public health to join the Youth Advisory Council, because it sounds like a lot of you were able to learn along the way about what public health was or is. And to be honest, a lot more people are starting to know a little bit more about public health now that we have been in a pandemic. But hopefully we'll have more people that are going to be more interested, regardless of how little or how much they know about the Youth Advisory Council, or I'm sorry, about public health in general. For this next question, this is where we're going to get into some of the nitty-gritty of the work that you all have done, a little bit more insight on some of the projects that you all have worked on and have been able to do in your communities. So I am going to pass this one off to start with Alana Cho. If you could start with this question. This question asks, what has been your favorite project or projects that you have worked on or been a part of in the Youth Advisory Council? So if you can share with us, what are some of those projects that you have really been able to have an impact in your community or for yourself?
Sure. So, I have loved working to help organize and facilitate the Public Health Youth Ambassador Program because besides kind of learning vital information about COVID-19, the Ambassador Program helped me pass on my newly acquired public health knowledge, as well as some of the just experience and knowledge that I've gained over the um, throughout my life to younger students and some of my peers. And so it really continued the rewarding and empowering ripple effect of public health. And it also helped me and my community specifically because it was right in the peak of COVID and it offered a reliable and credible source of the facts that could be spread to individuals in my community to keep us all safe. And I can pass it on to the next advisor.
Thanks, Alana. One of my favorite projects has been providing a youth perspective on the planning of the Mental Health Services Act 3-year plan, which is something that goes into effect and affects all of the mental health services in LA County. And I was able to present in front of the Department of Mental Health leadership, including the director of DMH, to express the needs of my community. Myself and a few other youth advisors, we spoke about the burnout and isolation that teens have been experiencing with COVID. And this experience really helped me to grow with my public speaking skills, and it gave me a chance to get more in touch with other youth by researching their mental health needs. In the long run, our advocacy in front of audiences like these will help reduce the challenges in the future and help those that have been affected heal from these issues. And I'll pass it on.
One of my main project interests before I started the Youth Advisory Council was the dangers and harms of vaping. So once I got into the Youth Advisory Council, I was able to work with my supervisor who is a current public health nurse, and we were able to come up with a strategy and creating a project in education on vaping. So I was able to partner with a local school district in the city of Whittier, where I attended many elementary, middle, and high school meetings and spoke and gave presentations on the health effects of vaping, which was such a great experience because I was at the same time helping myself in the way of learning professional skills such as communicating and presenting skills with the help of my supervisor and other public health staff, but I was also simultaneously helping out my community by providing this resource of education. And I think that was my main project, but this all occurred prior to the pandemic. Now, due to the pandemic, YAC, the Youth Advisory Council, has shifted virtually. And even on this online setting, I have been able to continue educational workshops for my community via online websites such as Zoom or MS Teams. And simultaneously, the same thing, I've been able to give back to my community, which has been such a great experience for me. I'll pass it on to the next youth advisor.
Thank you, Giselle. I would say that my favorite project I've worked on has been the Public Health Task Force. And the Public Health Task Force is still an ongoing project, and it focuses on bringing public health to high schools around LA County. And within this project, us as youth advisors were able to work directly with a variety of health educators on a variety of topics, and guide other youth to learn the same materials, as well as creating things and activities that were engaging for them to learn these materials and still have fun with it. And yeah, I really enjoyed it.
Yeah, I'd have to just agree with Yvonne. I think one of my most meaningful projects was also taking part in the Public Health Task Force, which is where we took students from schools and high schools around the LA County area, and we spoke to them about COVID, how to prevent COVID, and I found it really meaningful because this was during the peak of the pandemic, and I think knowledge was the best thing that we could pass on to people, and just telling them how they can stay safe and uh, what they can do to keep their families and their loved ones safe. And this gave me a passion for preventing COVID, and I was able to get a job once I came to college surrounding just doing that. And the experience that I gained from taking part in the Public Health Task Force helped me a lot in getting this job and being able to succeed in my professional career through this. So that's something that really resonated with me and helped me a lot along the way. And I'll pass it to the next youth advisor.
Thank you, Arnav. I would say that my favorite activity I've done recently was probably complete the youth first aider kind of like certification. I recently underwent training to become a youth first aider, in which I know the approaches to take when I witness a friend or a peer undergoing symptoms of poor mental health. So I think that was something I saw really prevalent in my school community and really wanted to help, just to help my peers and those around me. And I also underwent a film workshop over the previous summer, and I was able to intertwine public health with film, in which I hosted a film workshop in which I highlighted the importance of incorporating public health within film and entertainment. And I really enjoyed that project and just being able to interact with people as well.
Wonderful, wonderful. Thank you all so much for sharing that. I was hearing a lot of really interesting topics that you all mentioned about COVID-19 and sharing information about that to peers, sharing accurate information. Of course, there's always a lot of misinformation out there during the pandemic, but it really sounds like those of you who participated in that particular project were really able to combat not just the misinformation, but also giving back to the community and providing that safety measure for your community, right? And being a resource to your community as well. I was also really intrigued to hear about other different topics, like Morgan's topic on intertwining her interests in film making and public health and intertwining it together. And I think that that's what really is great about the Youth Advisory Council, is that a lot of you all come in with an array of different interests and different talents and different skills. And we really hone in and elevate all of those skills and strengths that you all come with. I was also hearing about how all of you shared just like a different perspective about a different issue that is very unique to your communities, about how to address those issues, right? And making sure that all of the information that you're sharing is relevant and that it resonates with your community, and that folks are going to listen between the ages of 16 to 21 years old, right? That it's geared towards them. So I really want to thank you all for sharing those awesome projects and for all the work that you did in those projects. I'm going to go ahead and move along to the next question. And this next question is where you all can definitely share Anything else that maybe we haven't been able to touch over in the other questions? But I think that a lot of the folks in our audience who are between the ages of 16 to 21 might also want to hear about this particular question. And this question is asking, why do you feel other youth should consider applying to the Youth Advisory Council? And if you could share, like, what are some aspects of the Youth Advisory Council that maybe are different from other youth programs? So we really want to be able to hear why should other youth be encouraged to apply to this Youth Advisory Council? Let's go ahead and turn it over to Morgan to answer this one.
Sure. So I think people should definitely consider applying to the Youth Advisory Council because it really allows youth to undergo these skills of, or to experience and strengthen their skills of leadership, communication, and collaboration. I think it's really important to fortify those skills, not only in the professional sphere, but also just in the kind of in regular life too. And I think that the Youth Advisory Council does a really good job with honing in those skills because you're able to think outside the box and brainstorm solutions to different issues. And also when you're presenting or undergoing projects with other youth peers, and you're able to kind of collaborate and put those minds together to become more creative overall in solving an issue. And so I think that just that experience allows you to not only fortify, as I said before, those skills, but just strengthen your overall collaboration and communication skills as well in the regular world.
And then I can go ahead and answer now. I would say that the Youth Advisory Council is different from a lot of other programs because it provides a flexibility that I don't think you can find anywhere else. Because this program is directly for youth, they're very accommodating and understanding that most of us are students, and school comes before anything. And they've been great at figuring out times and accommodating schedules that work for everyone in order for us to still obviously be active in our classes and in our schoolwork. And additionally, I think the diversity of the concepts within the program is really great. I was very passionate about law and public policy, and I didn't realize how connected it could be with public health until I joined the Youth Advisory Council. So the possibilities to connect a variety of different passions together within the program are infinite. And I would say that people should consider the work environment when applying for this program, because I guarantee that you probably won't be able to find an environment like this anywhere else. You're encouraged to learn through your mistakes because that's part of the process, whereas in a more, you can say, like professional setting, it's not necessarily the case. You learn to value teamwork greatly, all while still learning about public health. Members are really understanding, again, of your schedule, and they just want the best for you. And I feel like I've truly connected with the leadership at the Youth Advisory Council, which is something that you don't find in other programs. I've gotten very close to Pamina and Kevin and Liz, who all work directly with us. And I know for sure be keeping in touch with them after my term is over. So not only has the program been a great resource for professional development, but also a great resource to make lifelong friends. And it's truly been a core memory for me.
I totally agree with everything Yvonne said. I would add that I think anybody should apply who's looking to take on a leadership role and advocate for health in their community. Keep in mind, like it's been said, it's a big time commitment, but everybody here will help you with time management, and school is always prioritized above all else. Come with your ideas. A lot of our planning is youth-led, and everyone here wants to hear what public health topics you're interested in, even if they're interdisciplinary topics that may not seem public health related at first, like Morgan's film and public health or Yvonne's public policy and public health. Mostly, you'll just have a million chances here to step outside of your comfort zone and grow as a leader, and I hope that you take that first step in that journey by applying. And I'll pass it on to Alana.
Great, thank you. So I think that people should apply to this program because you can really see the immediate effect that you have on your community, and it's extremely fulfilling and inspiring. If you are passionate about public health, medicine, research, self-development, or kind of just helping your community be safer and healthier in general, I do think this is a great thing that you should consider applying for, because the Youth Advisory Council can really amplify all of the positive effects that you have on your community. And it can also help assist you in educating you or giving you contacts to help work with you to reach your related goals. I think one of the unique things about this program is, in addition to helping our community, it also teaches you so much from like guest lecturers and speakers from our events. And so oftentimes some youth-led programs or youth programs will focus on one or the other. They'll focus on serving your community through something like volunteerism or teaching a group of students about a particular topic. But in this way, the Youth Advisory Council is able to kind of balance both of them so that you have a greater positive impact on your community because you're more educated and because you have a wider variety of information that you know, so that you can go to your community and you can have all of this research and data backing up what you're trying to put out in your community. So I do think that's one of the special things about the Youth Advisory Council. And I can pass it on to the next advisor.
Thank you. And yeah, just to shadow what everyone said, I think the duality of being able to develop professionally and serve your community is a big takeaway from the YAC, and it is what other youth programs professionally have been able to enhance my public speaking skills. I've been able to, interact with Liz, Kevin, and Tamina, our supervisors, and learn about uh, uh, how to be a good employee and serve our supervisors. Even though we are just youth advisors, it's good to be able to learn how to interact with professionals in the field. And I've also been able to serve my community. Like Giselle mentioned, she identified an issue in her high school of vaping. She was able to use the Youth Advisory Council to make a program and identify how she can solve this issue, and she was able to do that. So I think just being able to serve the community and develop professionally as well, with the reimbursement that you are able to give in, you can learn about money management skills and being able to practice time management skills and having this position while being a student. So there's definitely a lot of skills that you can develop from being a youth advisor and that your community can benefit with as well. And I'll pass it on to Giselle.
I would just like to bump everything that my fellow youth advisors has mentioned already. But I would like to highlight the fact that in the Youth Advisory Council, you are directly partnered with a public health professional, and you get to create this one-on-one connection with your supervisor. And I, for example, since I mentioned earlier, my supervisor was a public health nurse, and I currently do not work directly with her. However, I still keep in touch with her and reach out to her when I have any professional or academic questions, which I think is super beneficial because I have this lifelong mentor. And another thing I would like to highlight is that the youth advisors are compensated for their work, which I think is a huge bonus because not only do I get to help out my community, which I love to do, but I get to also get compensated. And I think this is a huge highlight because a lot of the youth advisors, like how we mentioned, their age range is 16 to 21. And during this age range, the youth advisors are either high school students planning of applying to college or they're college students. And in my experience, I've used the funds that I have gained from the Youth Advisory Council to my college applications. And now that I'm in college, I've used them in any like textbook that I need for my college classes. So I think it's a prime time where students and youth need money to support them in the professional and academic career.
Thank you all so much. I feel like every one of you definitely shared something unique and something different about why folks should consider applying to the Youth Advisory Council. The Youth Advisory Council, right, is so multidisciplinary, and we bring in an array of different topics because every region that you all represent is unique. And so in the space that we have where we have those Youth Advisory Council meetings, we bring in those topics. And sometimes it happens that when those youth advisors learn about a specific topic, their interest is piqued and they want to be able to pursue a career in that specific topic. So I think that this Youth Advisory Council, as you all shared, is very, very diverse in the opportunities that it brings. It's not just for folks that are interested in going into the medical field. It's not just for folks that are interested in research. It's also an opportunity for a lot of you to bring in your ideas and bring in your fresh creativity, ideas. And really, the theme of the Public Health Week Day today is basically asking, how are we able to secure the future of public health? And we start with youth advisors. You are not just the future, you are the present, right? Youth advisors are the present. The youth are the present right now. And then as we're helping you all to develop those skills and enhance all of the skills that you already have, and bringing in all those talents that you already have, I think that what I thought was really, really interesting is that you all have been able to bring something special to the Youth Advisory Council, and that this Youth Advisory Council really is made up of all of your hard work, all of your talents, and all of your passion and authenticity that makes it what it is. So I definitely want to give you all a shout out for that. For making the Youth Advisory Council as supportive and as encouraging as it is for the next applicant, for the next cohort of youth advisors. And that's what it's really about, right? It's connecting within our communities and focusing on prevention, and not just on one specific topic, but an array of different topics, because as some of you mentioned, public health overlaps with so many other issues that you never really thought would overlap with, including like mental health and the COVID-19 pandemic, including safety, in like safety as you're walking down the street, right? So those kinds of things. So I think that listening to what you all have shared, one thing that I definitely wanted to highlight is that this Youth Advisory Council has grown because of you, because folks, you saw a need to join this Youth Advisory Council and speak on behalf of your community and speak on behalf of other youth. And throughout a pandemic, that's, really difficult to do. So I think that in some ways, this pandemic, one of the silver linings of it is that it's definitely brought a lot of the adolescent community together throughout the isolation, and that you all have definitely seen a need for all of the workshops that you all mentioned, all of the education that you all mentioned, and be able to give back and provide those to your community is a huge, huge victory. So I definitely want to thank you from the bottom of my heart. And I definitely want to thank our PYD leadership. I definitely want to thank all of our PYD supervisors that supervise the other youth in the service planning areas. I think we're going to go ahead and wrap up our event, our panel event, because we are receiving some questions from the audience. And I think that this would be a great opportunity for some of our youth advisors to answer these questions that are coming in. We have one question that came in. Actually, before we do that, before we go into the questions, I actually want to take care of something first and reiterate that we are accepting applications to the Youth Advisory Council through April 30th. And if we can share the slides from earlier to share the recruitment flyer that we have circling through social media and our networks, would that be possible, Kimberly?
One second, let me pull up the slides.
Oh, thank you. There you are. And we can go to the slide that has the flyer so that folks can either take a picture of it. There is a QR code on there. There's also the link to the application. So we are accepting applications until April 30th. You can visit the website that's on the screen here at tinyurl.com/DPH YAC. So that's DPH YAC. And there's also a QR code here that you can take a picture of or scan directly from your screen. And then on the next slide, we also have our other website that you can visit for more information at tinyurl.com/LACDPH-MCAH-YAC, where you can also visit. This is the Maternal, Child, and Adolescent Division website. And this one takes you directly to the section that provides more information about the Youth Advisory Council. We have a frequently asked questions sheet on there if you want to hear more information that you didn't get to hear today. And then with that, we can actually stop sharing the slides for now and take some of the questions that we received in the chat. So this is one question, very interesting, because this person, it sounded like they joined a little bit late. So if this was already addressed, they want to apologize, but they want to know what preparation or what kind of workshops goes into being a Youth Advisory Council member. So it sounds like the person is asking, what kind of preparation is there for youth advisors? And what kind of workshops are there? If maybe some of the youth advisors can talk a little bit more about some of that preparation or some of those workshops that you've been able to attend as part of the Youth Advisory Council or as part of being a member. So I'll turn it over to any of the youth advisors that would like to take that question.
I can go ahead and share first. So as a youth advisor, whether you're a senior youth advisor or a new coming regular youth advisor, there is trainings that you have to fulfill beforehand before you actually start getting to work. But I will say that the training is compensated, which is great because that doesn't happen at all in many workspaces. So you get compensated for all of it, and the trainings are a little bit longer, but you do have a lot of time to complete those, and you also have like direct help from Liz and from all the senior youth advisors who have done the program before and who have gone through the training before. I myself had to do it twice because the trainings are done each year or each cohort.
I'd also like to add that in addition to those trainings, we also have our monthly Youth Advisory Council meetings. They're always on the third Saturday of every month, so you can put those into your schedule beforehand, and they are required, so you're required to attend as many as you can. But we have trainings during that time. We have people from other organizations come and present. And then later in the year, we have youth advisors present their passion projects to the rest of us. So we're training each other in that point. And you can always pursue individual trainings and get compensated for those. You just have to organize that with your supervisor. So if there's something that you're interested in that's not being covered with the big group, you can always pursue that. And I'll also answer a second question in the chat, which is, has this experience inspired the YAC members to enter the public health field? And I will say personally, it absolutely has inspired me. I just finished the college application process and I applied as a global health major, and I am so excited to go into that field. And that is because of the Youth Advisory Council.
Thank you so much, Morgan, for answering that. I think there was a couple of you that wanted to take on the other question. Morgan, do you want to go ahead and answer the first one?
Sure. So regarding like preparation, I would just like to reiterate what's already been said. I think the trainings are a major part of the preparation for the Advisory Council, but the Advisory Council does a great job with preparing you for those and giving you any support that you may need, as well as the senior youth advisors as well. So I think that that's just like a entrance level or part into the Advisory Council. And also what Evan mentioned, the monthly advisory meetings, you can always put those on your calendar so you have those ready and you know when those are. So I think that's just kind of like those formalities of the advisory council. But other than that, you don't really need any prior health experience to join, as like I didn't have any prior health experience, so you definitely don't need any prior experience to join the advisory council and participate.
Yeah, actually, Shadow, what everyone said, we have a lot of trainings that do go on once you enter in. I know one that resonates with me to this day is in our first YAC meeting for every cohort, first Youth Advisory Council meeting, there is a Public Health 101 training, and it's about 2 hours long, and it basically gives you the rundown of almost everything you need to know about public health going into it. Of course, you're going to learn more day by day as you take part in experiences, but like what was said a lot earlier, there's nothing, you don't really need to know anything at all about public health because it's all going to be uh, given to you through these type of trainings and through your own experiences. And another training that resonates with me is we had a 2-day facilitation training that occurred on the weekend, and basically we learned how to facilitate different situations and how to be better at public speaking. That's a really big thing because in the Youth Advisory Council, facilitation and public speaking is something that you will be doing a lot of, but even if you don't come in with super strong skills in either of those things, they will definitely be developed in the Youth Advisory Council. So that's definitely a great thing. And I'll also answer the second question of if it has inspired me to go into the public health field. And I would also say definitely. Initially, I was pre-med, looking to going into medical school, and now I'm looking in going into MD, MPH programs, which is your master's in doctorate and master's in public health. And I'm also a public health minor now, so that's something I'm being able to pursue both. So instead of just like replacing my passions with public health, I've been able to combine them and combine my career interests with public health from the Youth Advisory Council.
Thank you so much. Go ahead.
Answer the same question as Arnav. Has it inspired me? Similar to Arnav, I'm currently in college right now, and I'm studying human biology with a concentration in public health, which is super exciting. And I feel like I wouldn't be doing this concentration if it wasn't for the Youth Advisory Council, because I would have not even known what public health really was. So now that I've been involved in the Youth Advisory Council, public health is definitely a field I want to pursue. I also, like Arnav, want to go to medical school and hopefully get my master's in public health, which is super exciting. And I'll pass it to anyone else.
I think we have another question coming in, so I'm actually going to jump over to that one. We have a question on how has being in the Youth Advisory Council been an asset while being in college? So for those of you that are in college, maybe you want to take this question. I think Arnav, you definitely mentioned how this experience was able to provide an opportunity in college for you. So if you want to share a little bit more about that, that would be great.
Yeah, of course. So I had mentioned that I took part in the Public Health Task Force, being in the YAC, and that is actually something that I was able to apply going into college. So a job opportunity that was in my college called the Public Health Peer Lead opened up, and that was basically surrounding preventing the spread of COVID on campus, since that's something that's really big as people are dorming together and people spend a lot of time with each other. So just preventing that spread, and the knowledge I gained from the Youth Advisory Council helped me with doing my day-to-day activities in my job, as well as even getting the experience. Of course, having on my resume that I was a part of the LA County Department of Public Health and was a senior youth advisor, and being able to express in my interviews that I knew the knowledge of public health and what it took to spread decrease the spread of COVID. That's something that they saw in me and has been able to help me in my career in college. And yeah, I'd pass on to anyone else.
Yeah, I can definitely agree with Arnav that it's been a great resume builder, because not only can you say that you've worked, with the Youth Advisory Council with health educators, but within the program, there's also other training opportunities. So like there's one that I'm thinking about right now. It's a mental health training, and you get a separate certificate for that. So you can be certified, with something separately while also being compensated for that training. And I would say it's also just been a great network resource for me. And I don't mean that just professionally. I mean that also with like friendships. I mentioned this to Liz before, and I talk about this all the time. When I first moved to Berkeley, I didn't know anyone at all. And I just so happened to know someone within the Youth Advisory Council that was also going to Berkeley, and they are not in the program anymore, but we stayed connected because of this program. And she's actually one of my closest friends now, which is great. So it's been a great network resource for friendships as well. And like I mentioned before too, like I'm sure that I'll definitely be in touch with so many other people from the council.
Thank you so much, Yvonne and Giselle and Arnav, for taking that question. Truly, I think that one of the things that resonated with me that you all shared is just how, again, going back to the beginning, is that you don't need to know much about public health, but this definitely can help you to explore public health as a career. Although that's not the goal, it kind of ends up being the goal because, again, public health overlaps with so many different other health issues topics. We do have one more question that is asking from the audience. I think you all already answered this question, Yvonne. Does the Youth Advisory Council also feed into post-council internships or jobs? I think we had one more person who wanted to answer that one. I'm not sure if there's another youth advisor that wanted to take that one.
I can. So for this question, if the Youth Advisory Council also feeds into post-council internships or jobs, within the Youth Advisory Council, a lot of the staff they're always sending opportunities to us. For example, this internship position opened, or there's this club or this other youth program that you could join. So I feel like that's one of the ways that the Youth Advisory Council helps us, because not only do they want us to be involved in this program, but they also open the doors by sharing other programs to us and other internships. And I would say that being involved in the Youth Advisory Council, the fact that once we complete our term here, we're able to use our supervisors and other staff that we worked with as, for example, for a letter of recommendations or as people of reference. And I think that really helps us when applying to outside internships and other opportunities. For example, here at Stanford, I applied for this program to work with the global health director, and the fact that I put it down on my resume and I had my supervisors on there, it really intrigued the position to ask me questions about my experience in the Youth Advisory Council. So I think it's such a great networking opportunity because we grow a lot here in YAC and outside of YAC. So I think that's one of the great benefits of being involved in this program.
Thank you so much, Giselle. And thank you all so much for being so thoughtful with your answers because, again, I think all of you have definitely taken this experience and maximized it into your next endeavor in college or in a different setting. We have another question that just came in. I think we're going to take this one as our last question since we are getting close to our ending time. They are asking, oh, they're actually providing a comment. We need more infection prevention. Would love to introduce infection prevention as a career to those interested in public health. And this is actually a really, really great opportunity to be involved in how infection prevention works. So I would definitely say that, there is a lot of opportunity to get to directly speak with some of our infection prevention specialists, infection prevention staff in the Department of Public Health. And so I'm looking at the time here, but I just wanted to thank the audiences for providing those questions so that the youth advisors can answer those for you. And I really hope that today's panel, getting to know the youth advisors, 6 of the 31 that we have in our council, was helpful to learn about the amazing work that they have been doing throughout the pandemic and beforehand, and to learn a little bit more about what the Youth Advisory Council entails of. For those that are a little bit over the fence, definitely feel free to reach out with the contact information that we're going to put on the slide in just a second. But you can also, again, reach out to us or learn more about us on our website as well. So this is our contact information. My name is Lisbeth Becerra. Our colleagues are Pamina Bakshi and Kevin Donovan. Feel free to send us an email there to ask us a little bit more questions. But overall, we definitely wanted to highlight the wonderful work that the youth advisors have been doing throughout their term here in the Youth Advisory Council for Public Health Week. Because again, the youth advisors are not just the future, they're our present. This is what they're doing as we speak. and really making an impact in their communities, and being able to take those experiences and maximize them into their next community campaign, community event, and be able to share that wealth of information to their communities, their families, their friends. And truly, I've seen all of these youth advisors grow from the very first day that we met. And I truly am super, super amazed, super, I don't know, it just warms my heart to see how much you all have grown. I remember when I first met Giselle, and just learning about the work that she had done in the past, and how, she's really, really been able to balance everything, even as a first generation student that she is at Stanford University. And same thing with like Yvonne, Alana, you're going into your next chapter in college. And I know that Arnav, you're currently in college right now, Evan, Morgan, and you all are doing such wonderful work and being trailblazers for the future. So with that, I want to thank you all for being here today. Thank you again to our colleagues in the Department of Public Health. And we hope to see your applications coming in. But we hope that you also tune in and watch the rest of our Public Health Week events this week. Have a good night, everybody. And, definitely feel free to reach out for any other questions. Thank you all so much.
The stream is